Surviving a car accident is really just the beginning. Even if you don't have any symptoms, there can still be hidden injuries that can come on over time, especially in the neck. If you are feeling symptoms after a car crash, neck pain, stiffness, headaches, ignoring those symptoms is not a good option. This is why it's really important, whether you have symptoms or even if you don't, because often hidden injuries can exist, it's really important that you get your spine checked by a qualified professional. In this video, you will learn about the mechanism of whiplash injury and how they can often cause one of the most severe types of spinal misalignments in the neck. Research has shown that this type of severe misalignment of the neck is 18 times more prevalent in people with neck pain. The problem is this type of significant injury, often caused by people involved in motor vehicle crashes, is often overlooked by medical doctors, specialists, and even a number of chiropractors. If not discovered and corrected, this type of injury can lead to years of neck pain, disability, spinal arthritis, and degenerative joint and disc disease. If you were involved in a car collision, this may be one of the most important videos for you. Not only will you learn about how the neck often gets damaged from car crashes, I will also discuss how to apply research-based, non-surgical corrective care techniques that can rehabilitate the spine to its optimal position so it can function better for long-term recovery. In addition to that, I will share with you a groundbreaking, first of its kind, in-depth case series published in the Journal of Clinical Medicine in 2023. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. We developed this channel so that you can learn about improved health through improved spinal alignment and posture so you can look better, feel better, and perform better. So in many whiplash injuries, the neck basically moves in two directions. So when you are in an accident, and many of these are rear-end collisions, the car that hits you from behind propels the vehicle forward. And often, if our head is not directly on the headrest, when the car moves forward, the head snaps back. This is then followed by when the vehicle comes to a stop, the head snapping forward. So we're damaging ligaments that support both the anterior and the posterior aspect of the cervical spine, and this can damage muscles and discs as well. This type of injury that can affect multiple planes of motion often results in a loss of the normal neck curve. This most commonly produces what's considered an S-curve. If we see an S-curve where there should be a nice cervical curve, that is often a sign that that neck was damaged from a whiplash injury, many of which occur from the rear end collision type. Now, it's so important that if you're in a car crash, that you get yourself checked, because if you have a loss of that nice cervical curve, which actually acts as a shock absorber to distribute the weight of the head, which is 8 to 12 pounds in an adult, if you have an S curve, instead of the weight being able to be distributed throughout the movement of the normal cervical spine, what happens is the discs themselves start to get loaded, the facet joints get loaded with additional stress. This can cause degenerative disc disease and degenerative joint disease. This can set people up for long-term degenerative changes, leading to neck pain, stiffness, headaches, and even increased disability. And these issues can start with a loss of cervical curve that can have no pain initially. And that's why oftentimes people will not get checked when they should. So if you've been in a car accident, it's imperative that you get checked and make sure, did you lose that normal alignment? Because structure determines function, and over time, if not corrected, that will lead to problems. So, as good as our hands are, right, they're not magic. So a proper evaluation when you get checked, we have to have x-rays. You've got to look at that bone structure to see, how are those ligaments holding up? Are they damaged? Are they able to keep that spine in the proper alignment? So proper evaluation is you have to have x-rays. And weight-bearing films is so important because that's how you see how the body is withstanding the weight of the head and how it is reacting to the forces of gravity. When you lie down, there could be buckles or slippages that you're just going to miss because the spine is not loaded. As I mentioned earlier, if this is not properly addressed and more importantly corrected, this can lead to long-term degenerative joint disease, long-term degenerative disc disease, which together cause long-term symptoms of pain, stiffness, headaches, and disability. So how do we treat conditions like this? And this is what really sets apart corrective chiropractic care from traditional chiropractic care or other therapies such as physical therapy or osteopathic manipulation. For corrective care, we apply a protocol called the E.A.T protocol, E.A.T. That stands for a combination of mirror image exercises. So if we've lost that cervical curve, we have to do exercises that encourage the tissues to start moving in their more proper position. Then we do mirror image adjustments. We do traditional adjustments that most people are familiar with, but we also adjust while we're putting that body into a better alignment. That can trigger proprioceptive fibers, which send information into the brain to tell your brain about posture and position. So that's very important. And then the linchpin of the whole process is mirror image traction. We have to apply targeted traction over time to achieve ligamentous creep or changes in the ligaments that will stay and become permanent. That's the only way that you can really work out those abnormal curves and help to restore the normal cervical curve posture. And folks, it's really clear in the literature, you have to apply this targeted force between 12 to 20 minutes each session in order to get the amount of dosage that will change the lengths of the ligaments that you're being targeted. And that's why traditional adjustments or physical therapy-based exercise, while those are helpful for other reasons, they will not help to reestablish the normal alignment of spinal structures like the cervical spine. As a bonus, I'm going to show you what one very common mirror image exercise looks like. So this device here is called a prolordotic neck exerciser, and it's designed to help restore lost cervical curve. It's very simple. It's just applied physics, really. So we use this curve where we put it in the area of the neck that has lost its normal curve. It's kind of like a glorified TheraBand. We can create some tension. It's a 2-point pull, basically. So we extend the arms in this direction, and I can tilt my head back. And you can picture if someone has a lost cervical curve, this can help to start getting the tissues used to moving with the more proper alignment. So this is one example of a simple tool that can be very effective as part of the E.A.T protocol in curve restoration. All right, now I want to share with you a groundbreaking study published in the Journal of Clinical Medicine in October of 2023. More information will be in the links below the video. The title is Positive Outcomes Following Cervical Acceleration Deceleration Injury Using Chiropractic Biophysics Method, a pre-auto injury and post-auto injury case series. This is so important. This case series demonstrates that motor vehicle collisions may alter the alignment of the cervical spine, and rehabilitation of the cervical curve using extension traction improved patients' initial pre-crash alignments toward their pre-injury alignments and was likely responsible for improvement in the patient's conditions. Now, this information here describes a lot of the E.A.T protocol that we use every day as corrective care chiropractors. To find a corrective care chiropractor near you, go to www.idealspine.com and you will find a doctor locator where you can put in your address or zip code and find offices near you. Now, I want to hear from you. If you were in a car crash and have a story you would like to share, put it in the comments below. If you have questions that you would like regarding additional information on proper rehabilitation methods from injuries sustained in car crashes, let me know. If you found this video useful, please share it so you can spread this information to others that hopefully may find it useful as well. And if you have any other comments or topics you'd like us to cover in the future, please leave those in the comments as well. Thank you very much for watching. Have a great day.